Okay. Alright, so the first thing I'm going to do after I'm going to perform my hand hygiene. Hi, my name is Olivia. I'm a nursing student with the University of South Alabama and the College of Nursing, and I was going to perform my abdominal assessment on you today, if that's okay.
All right.
Alright, can I get you to take your hat and your shirt off, please? Alright, and so then what I want you to do is I want you to lay down flat with your head on the pillow, knees bent, and I want your arms at your side, please. Okay, so looking, the first thing that I do notice is that your contour is flat, your skin tone is evenly distributed throughout the rest of your body. I do see some scant coarse hair on your abdomen. I don't see any scars. I don't see any angiomas. I don't see any freckles. I also am not noticing any masses or any hernias or any distension. No peristalsis. Also, I forgot to ask you before I started, did you empty your bladder, or do you need to empty your bladder?
No, I'm
No? Okay, great. Okay, and so as far as the assessing and inspecting your abdomen, that looks fine. So the next thing that I'm going to do, if it's okay with you, is I'm going to auscultate and I'm going to listen for vowel sounds, okay?
Mm-hmm.
And I'm going to be using the diaphragm of my stethoscope. Okay, so your bowel sounds are normal active, and so what that means is when they're normal active, that I can hear them about 5 to 30 times a minute in each quadrant. That is a normal finding. That also means that they're more like high-pitched sounds, some gurgling, cascading sounds going on. If they were hyperactive, it would be more than 30 times a minute. They would be a little louder, more high-pitched. I would hear some kind of like rushing or tinkling noises. If they were hypoactive, I would hear them less than 5 times a minute, and they would be a little quieter, not as loud. And then if I suspected that they were absent, what I would do is I would listen in your right lower quadrant for 5 minutes just to confirm that they were absent. The next thing that I'm going to do, if it's okay with you, is I'm going to check for tympani. Alright, so I'm just going to place my hand on you in different regions, and I'm going to use this striker on my finger, and I'm just going to be listening, okay? Actually, before I do that, I'm going to listen to your arteries, okay? Checking for bruise. So I can see your aortic artery, which is normal. I should be able to see a pulse in that. The first thing I'm going to listen to is your aortic artery with the bell. All right, next I'm going to listen to your renal artery. So if I could I just get you to kind of bend your arm up for me? I'm going to go right along about that line. All right, and then next I'm going to listen to your iliac. I'm going to go along this iliac crest. Okay, there were no bruises noted, so that's good. The next thing that I'm going to do now is I'm going to percuss with this and be listening for tympani, okay? Okay, so listen to that. I do notice that your left side does appear to be a little bit more dull than the right side is. And the difference in those sounds on the left and right could be from stool, it could be from fluid, anything in that abdominal region. The next thing I'm gonna do is I'm gonna palpate a little bit. Is that okay?
Yep.
So I'm gonna lightly palpate, and I'm just gonna be checking for like your surface character and your muscle strength, okay? Or your muscle tone. Okay, was there any pain or tenderness when I did that? No? Okay, so your muscle tone was good. Next I'm gonna more deeply palpate a little bit, checking for any masses, okay?
No.
All right, was there any pain or tenderness with that?
Not at all.
So I didn't notice any masses, so that's good. The next thing that I'm going to do is I'm gonna palpate for your liver.
No.
So if I could I get you to kind of bend that arm back up again? What I'm gonna do is I'm gonna go kind of in this costal margin area. And what I want you to do is I want you to take a deep breath in for me and then exhale. I'm gonna place my hand behind your back, sorry, okay? All right, deep breath in and exhale. Okay, again. Okay, one more time. Okay, so I am able to feel like the lining of your liver, the outer edge of your liver, which is normal, but there's another way that I could do it. It would be the hooking method. And so with that, I would come up here and I'm gonna come down and I'm gonna ask you to do that deep breath in again and let it out. Okay, I am able to feel that portion of your liver. So the next thing that I'm going to do is I'm short, so I'm gonna have to go to the other side. I'm gonna reach across you,
No.
up under you,
No.
okay? And then I'm going to check for your spleen. And so what I'm gonna do with that is the axillary region. And so I just want you to kind of do more or less the same thing. And take that deep breath in and out, okay? One more time. Okay, I'm not able to feel your spleen, but that is normal, okay? All right. And then the last thing that I'm going to do is I'm going to ask you to sit up for me, please, and face that way. And then on this side, please. No. All right, so I'm going to check you for costovertebral angle tenderness. And so what I'm going to do, that should be about your 11th or 12th rib region. Okay, and so I'm going to put my hand there. And I'm going to strike the back of my hand, okay?
No.
Did you have any pain or tenderness there? Okay. Any pain or tenderness with that? Okay, so there was no costovertebral angle tenderness, and so that concludes our assessment for this.